Peritoneal inclusion cyst seen in a 22-year-old student who was a virgin with suspected hemorrhagic cyst in the left ovary with the right endometrioma. Follow-up 7 weeks after showed no regression in the size of the cyst. This supports endometrioma rather than a hemorrhagic cyst. There was also associated peritoneal inclusion cyst. Peritoneal inclusion cyst is usually a feature of adhesions, which is unlikely to be associated with a hemorrhagic cyst, but more likely to be associated with an endometrioma. This patient was a virgin, and therefore pelvic infection cannot explain the presence of the peritoneal inclusion cyst. Now, this is a transabdominal video because of the vagal intactum, so a transvaginal scan was not done. Here you can see the bladder, the vaginal stripe here. In fact, one can see one of the ureteric opening here, and instead of the uterus being here, what one can see here is the ovary, suggesting malposition. Here you can see this thin band, which is peritoneal inclusion cysts, what is also described as the flapping cell sign. So let's play the video. So you see this, the flapping cell sign. Here look at the ovary, part of the bowel here, and note that the bowel here is adhered to this ovary. Again, this is not a feature of hemorrhagic cyst, but a feature of endometriosis. Here I will try and demonstrate by applying probe pressure and see whether the content of this cyst will jiggle. It will, or it may, if it is a hemorrhagic cyst, but it's unlikely if it is an endometrioma because the content is often thick. Although this is best achieved through a transvaginal imaging, but the principle is the same. Here you can see the size of the cyst has remained the same over 7 weeks, supporting the fact that this is a case of endometrioma and not hemorrhagic cysts. Again, look at the peritoneal inclusion cyst, which is usually associated with endometriosis and not with hemorrhagic cysts. This patient is not sexually active, and therefore pelvic infection is an unlikely diagnosis to explain the presence of this peritoneal inclusion cyst. So look at it. It's not jiggling. See that? So this is likely to be an endometrioma rather than a hemorrhagic cyst. When there is doubt as to whether the cyst is hemorrhagic or an endometrioma, a follow-up is necessary to clear the doubts. In this case, the doubt has been cleared with this 7-week duration of follow-up. Thank you very much for listening.